Silicosis is a lung disease caused by inhalation of crystalline silica dust over many years of workplace exposure. Silica is a compound found naturally in sand, rock, and mineral ores. Common jobs where silica exposure may occur are mining, grinding, sandblasting, foundry work, quarry work, tunneling, construction work, stonemasonry, and ceramic and pottery making. The symptoms of silicosis generally do not appear until at least 10 to 15 years after initial exposure to silica dust. As the tiny silica particles accumulate in the lungs over many years, they can cause inflammation and permanent scarring, fibrosis, of lung tissue. This scarring makes it increasingly difficult to breathe over time. Some early symptoms of silicosis include shortness of breath, especially during physical activity. The scarring restricts the lung's ability to fully expand. Coughing, sometimes with phlegm. Coughing is generally worse in early morning, which helps clear some of the accumulated dust from the lungs overnight. Chest tightness or pain with breathing. As lung tissue thickens and stiffens, it causes discomfort. Fatigue and lack of energy. Reduced lung function makes any activity that requires more breathing feel tiring. Weight loss that is unintended. Symptoms may worsen a person's appetite or ability to absorb nutrients. As silicosis progresses, the symptoms worsen and additional complications can occur. Progressive shortness of breath, even at rest. Daily activities become difficult. Severe cough that produces large amounts of thick, sticky mucus. Diffuse chest rales, crackling sounds, upon lung examination that indicate fibrotic tissues. Clubbing, deformation, of the fingertips indicates severe lung dysfunction and scarring. Cor pulmonale, right ventricular failure of the heart caused by lung disease. Pressure overload from poor lungs can damage the heart over time. Susceptibility to other lung infections like tuberculosis. Fibrotic tissues are vulnerable to colonization by bacteria and viruses. Wheezing as bronchioles constrict in response to irritation. Fatigue so severe that bed rest is often needed. Sufferers may become fully incapacitated. Silicosis has 3 recognized types based on cumulative exposure levels and progression of symptoms. Chronic silicosis develops after at least 10 years of moderate exposure and causes mild to moderate fibrosis. Accelerated silicosis results from high exposures over 5 to 10 years and more rapidly causes severe shortness of breath. Acute silicosis is very rare, only occurring after several months or years of intense exposure, and results in severe life-threatening symptoms within 1 to 2 years due to massive, irreversible lung scarring. Complications like tuberculosis are common in advanced silicosis. There is currently no cure for silicosis and treatment focuses on relieving symptoms. Lung transplant may be considered for those suffering most advanced disease. Mesothelioma is a rare type of cancer specifically associated with asbestos exposure. Asbestos is a group of fibrous, heat-resistant minerals historically used widely in construction materials like insulation, brake pads, fireproofing, and roofing products prior to its regulation in the 1970s. Asbestos was often used because of its fireproof qualities but is now recognized as a potent human carcinogen. Only a few exposures over many months can lead to mesothelioma 30 to 50 years later as asbestos fibers accumulate in the thin mesothelial membranes surrounding organs. The 3 main types of mesothelioma are pleural, chest cavity, peritoneal, abdominal cavity, and pericardial, heart sac. Pleural mesothelioma accounts for approximately 75% of cases. Early symptoms are usually nonspecific but may include new or worsening shortness of breath due to pleural effusion, buildup of fluid, or chest wall pain from cancer growth along the chest wall. Constant dull pain under the rib cage or in the side of the body that worsens with deep breathing, coughing, or other movements. Persistent dry cough unrelated to cold, infection that becomes more noticeable over weeks to months. Fatigue, weakness, and weight loss due to overall decline from cancer and reduced ability to breathe fully or move easily. Recurring pneumonia or other chest infections as tumor masses grow and impair lung functioning. Ascites, abdominal fluid buildup, and abdominal pain in cases of peritoneal mesothelioma. Physical signs of pleural effusion include diminished chest expansion and dullness to percussion over fluid areas. Advanced mesothelioma symptoms include severely restricted breathing, chest wall masses felt on exam, obvious wasting, and fluid buildups large enough to impact daily living. Symptoms worsen as tumors spread locally and metastasize throughout the body. Overall prognosis is very poor, with current treatments able to modestly extend survival in some patients. A definite diagnosis requires biopsy and pathological confirmation of mesothelial cell types under microscopy. Those at heightened risk of mesothelioma through occupational or familial asbestos exposure should be monitored long-term by physicians. Both silicosis and mesothelioma are devastating lung diseases caused by industrial inhalation exposures to crystalline silica or asbestos fibers. Silicosis tends to have a longer latency period and gradual progression of symptoms, while mesothelioma moves more rapidly after a long latency. Early symptoms are nonspecific, but advanced stages for both diseases involve severe shortness of breath, coughing, weight loss, fatigue, and frequent infections as lung tissues become increasingly scarred and function declines. Treatment options remain quite limited, so prevention through exposure controls has always been the most viable approach. With reduced occupational exposures in recent decades, incidences of these lung diseases are decreasing, but medical monitoring will remain important for high-risk populations.